So thanks for coming along today. We're going to have a conversation today, which hopefully should be informal but informative. So we're bringing all four of you together to have a conversation around substance misuse and digital solutions that can work in that space. This is a production we're doing in partnership with DHI in Scotland, and hopefully, as members of the ECHAlliance, we'll be able to share this amongst a global community to look at Scotland's approach to this and what you see as some of the challenges and some of the barriers. But before we go on, because I'm conscious you probably don't know each other, I'll just introduce myself to you. I'm Andy Bleeden, the Communities Director for the ECHAlliance, the Global Health Connector. We're a member organisation with about 1,100 members all over the globe. We bring them together in ecosystems. We match need and solution. And hopefully that's what we're going to do here today. My background's in psychiatry, working with mentally disordered offenders and in the field of dementia for 35 years now. It used to be 25, but that was 10 years ago. So that's a bit about my background. I'd like to perhaps introduce you, Alex. Tell us about yourself.
Thank you. My name is Alex Baldacchino, and currently working as a professor of medicine, psychiatry and addiction. I'm a psychiatrist by training with St. Andrews University, but I've been working in the field of substance misuse for around 30 years or so, and I've just retired as a practitioner, as a specialist in addiction, and talking about 30 years, etc. Retired after 40 years of working as a practitioner, but still working in the field of addictions. Internationally, I'm just past immediate president of the International Society of Addiction Medicine, which has around 15,000 members, and I'm the chair of the Addiction Psychiatry section of the World Psychiatric Association. But I've been invited here, because I'm pretty sure, is because I chair the Chief Science Office Innovation Consortium that is very much around reducing drug deaths.
Okay.
And as a result of that, I'll talk about that in due time about it. So I hope that.
Thanks for that. Moira.
Hi, I'm Moira Mackenzie. I'm the Deputy Chief Exec with Scotland's Digital Health and Care Innovation Centre. So our interest in the area of substance use issues has been very much around about our experience of doing very complex digitally enabled programmes round about service change. But I'm also very personally engaged in this area as well because of my kind of previous working experience within a health and social care partnership in Scotland, and particularly running supported housing and homelessness services. Homeless services being an area where a lot of people unfortunately gravitate towards when there's been issues around about addiction, sometimes linked with mental health issues, etc. as well. So I have, as I say, a personal interest, but a professional interest from the digital services perspective.
Thanks for that, Moira. Alison.
Hi, I'm Alison Crocket. I'm the Whole Systems Unit Head at Scottish Government in the Drug Policy Division. I've been there since about May last year. My responsibility at the moment includes essentially all of the bits of drug policy which aren't directly pertaining to drug treatment in itself. So the social determinants, essentially mental health, housing, youth, women, the whole raft of human rights, stigma, those kinds of things that fundamentally impact on people who use drugs but aren't necessarily to do with their the substances that they're ingesting. I have a long history with drug policy and drug work. I started in 1984 as an outreach worker on the streets in Kilmarnock, working with people who use drugs, and then spent the next 16 years in there, and then rehab in Phoenix and Merseyside, and then working with young people, experienced young people who were using substances. And then by a quirk of fate, moved to the Foreign Office as a mid-career entrant in 2001 and spent 11 years altogether working in the United Nations Office of Drugs and Crime at the UK mission, and then I worked in UNAIDS in Geneva 4 years, and then did some more things in Foreign Office and came here last year. So been very much interested in drug policy, both in terms of practice and in policy for many years.
Thanks for that. Sally.
Sally Dyson, community development worker by trade. Currently head up the digital and development team within the Scottish Council for Voluntary Organisations. And we're the membership organisation for all community and voluntary organisations across Scotland. I'm really interested in this from a digital inclusion aspect. Many people across Scotland are socially excluded as well as digitally excluded. And community and voluntary organisations are often at the core face of supporting people, and that's where my interest is.
Thanks for that. Useful. I think useful to just get a flavour. For me, this is personal. I've buried too many clients, friends, and family through substance use, and it's personal. And that, I think, for a lot of people, they hear Scotland and they hear drugs and they hear death often, and that's been challenged. That's been talked about openly. Alison, what's the size of the need here in Scotland?
I think, well, you will know that the former First Minister launched the National Mission on Drugs in 2021 following a record year of drug-related deaths. I think there was 1,330 people, I think, dead that year. And, very much focused everyone's mind, I think. I think you're quite right. There has been a very long history of drug use and polydrug use in Scotland for a long time now. The mission committed an additional £250 million in the life of the government, the Parliament, to try to address this and redress the issues. And essentially that has, we're kind of halfway there almost. And that has been spread across a range of different initiatives which look to improve the quality and scale of the treatment that people who use drugs can access, the opportunities to seek rehab should they want to, but also to seek their recovery in their way, which is why we have this whole raft of different initiatives now which are associated with the social determinants, and giving people an opportunity to find their way and to acknowledge that that this is frequently trauma-driven, and that it moved off from what used to be a criminal justice approach to what is very much now rooted in a public health approach, which is why we're really focusing on improving the health outcomes for people who use drugs.
Thanks for that, because it's important, I think, to get facts, because we're talking about matching needs and solutions. So that's the thing to see quite clearly.
Yeah, very much.
And in terms of solutions, where do you think digital plays a role in Scotland? Where do you think?
Well, it's interesting that it had to be the drug deaths that helped us focus, but I think historically Scotland has been ahead of the game in most things, especially on reduction perspectives. But we are where we are, and one of the important element of this focus of the drug mission is that services, not necessarily just statutory services, have a quality principle. They're very clear around being person-centered, and also standards of care, quality medication-assisted treatment. It's the mantra, should be the mantra for everyone who's delivering. The reason I'm mentioning those two is that that is important, fundamental. But part of the thing of getting out of the comfort zone, knowing that there is a whole raft of digital landscapes out there, could not and cannot be at this particular moment be met by the addiction mission. So the post-COVID, the Chief Scientist Office has recognized that there are several components in the health and social care system that needs new thinking, new ways of delivering effectively, timely. And one of the mission tasks was that of reducing drug deaths. And so 2 years ago, I was asked to chair the leadership consortium around this, and to think beyond the obvious, beyond the important components, getting everyone involved. And as a result of that, we managed to focus people's attention, get new money in order to support our first challenge call, which is about recognizing and responding timely in episodes that could potentially create or become fatal overdoses, or they become drug deaths, as from a statistical point of view. So I hope I'll have the time to talk about what actually happened with that initiative, but that is happening in parallel with what has been described as a very focused mission. One element that is important and for food for thought as well is that I think in Scotland we have an opportunity not only to reduce the drug deaths, which most of them are preventable, but to reduce the alcohol deaths and suicides. And because as a whole system approach, we need to understand that these mortalities have a lot of cross-sectionality to why these things are happening.
I think that's what's changed. I sort of remember when drug use and mental health were mentioned in the same sentence. Your client was going to get shown the door because there's an excuse for cutting our service. But I think now there's a difference in that whole approach of seeing not only substance misuse, substance use, drugs death, alcohol death, etc., in the whole round is different. So on the user, you talk about the co-user involvement. What do you think is a role for users to get involved in the digital solution side more?
Yeah, I think the national mission has allowed us an opportunity to think about doing things differently. And again, because of that investment over a 5-year period, it's not a kind of switch on, switch off type approach, which very often these kind of initiatives it might be. So what's happened is that Scottish Government, through a range of different directorates, including Digital Health and Care, the Drugs Policy Team and our Connecting Scotland colleagues, have invested over £3 million looking at how we might use digital within the Digital Lifelines programme, so a 3.1 million investment over a 4-year period. And what we've been doing there, exactly as you touched on, Andy, is co-designing with people, getting to where people are themselves individually or as communities, and trying to find out what their individual challenges and experiences are, and then thinking about how we might utilise those insights to properly design the types of digital solutions that might help meet some of those challenges. So, for example, things like easier access to treatment might be an area, because we know, and Alex and his team in St Andrews have done quite a lot of work on identifying that where we can connect people into treatment, then it obviously increases their chances of going on in life successfully, but also avoids the drugs death issue that we have. So we're looking at things like again, how do we use national products like our Near Me video consulting service to think about how we make that suitable for people with substance use issues and often co-occurring mental health and other associated challenges, how we use those types of platforms to not just be available in the usual hours of operation as well. Can we take those services to where the people are at physically and at a time that suits them, and enable them to get easier access to treatment? So that co-design approach has been really, really important in trying to listen to where people's challenges are. When I'm ready to come forward and access treatment, those services are not always open or in the place that I would find it easy to get to. I've maybe not got the money for the bus fare to get there, and once I do get there, there's very often maybe a feeling of stigma that's attached to my approach as well. And how might we use digital to take away some of those things, and maybe make that relationship much more successful from the outset?
What does good look like now? In terms of right now, what if there was one thing that we weren't doing this 5 years ago, this works, and we need to do more of it, what would it be?
In terms of digital or services generally?
Digital.
I think for me, digital is about being in the hands of the users, so being in the hands of people that are using the technology, but also, and maybe this is where I'm sure Sally will have some thoughts on it, making sure that people have got the skills and actually the getting the technology, having the connectivity, actually engaging with staff in a different way as well. So the whole agenda around about digital inclusion is very much something that Scottish Council for Voluntary Organisations has absolutely championed.
Well, that's because that leads us on to the Lifelines program.
Yeah.
So what do you think? Because I'm interested in impact, not fancy sort of headlines. I would like what has been the impact within that Lifelines program for you, sir?
So the impact has been really significant. Digital is such an interesting word, and it means so many things to so many people. But first, you've got to be part of that digital world, and the people that we're working in Digital Lifelines, which is around making sure that everybody can access the digital services that we're developing and that are being developed with them. And that digital inclusion is around 5 things, as Moira started to highlight. It's around making sure that people have skills and confidence and the literacy and understanding around digital, because it's not just around phones and laptops, it's around wearables as well, and where is somebody's data going, and putting people really in control of that. It's about having the right devices, affordable connectivity all the time, because that's really critical for many people. If your mobile phone fails you at that critical moment, then that could be the difference between life and death. And it's around people having the motivation. There are still lots of people who go, why? I can quite happily get along with my life without being involved. And really critically, it's around how we design services with people to make sure that those services are accessible to them when they need them. And so that impact can have really wide-ranging consequences, from saving somebody's life right through to where that takes them in terms of rebuilding and reconnecting with lives and services. So there are many, many impacts of the individual, but also for people who care about those people, that individual. And I'm sure we'll come on to that in a little bit.
Well, you mentioned about devices, because there's always, with digital, you've got two arguments usually. There's people who want to drive at a great pace, but there's also people who say, oh, we won't be, there's people that don't have access to these devices, or it's going to be too. How do you get rid of some of the myths like that within this program? Have you?
So there's a really strong myth that if you give someone who uses drugs a device, then they're going to sell it, they're going to lose it, it's an expendable piece of kit, and there are other more important factors. Across the UK, 50% of people who are online have lost a device or have chosen to sell their device. I've lost a couple of devices, and nobody's saying to me you can't have another one. Within Digital Lifelines, we're really bucking that trend. So what we found with the people that we've been supporting, 1,600 of them so far, less than 4% of people have chosen to not keep their device. And I think that percentage is really stark, and it just shows how valuable people find that device. And the links to so many different aspects of support, of value along their recovery journey. So that's a myth that we need busting straight away, so everybody can take that fact home. That would be amazing.
I mean, the other thing I'm always interested in, as well as dispelling myths, is stories, because stories wipe out hype, they wipe away lack of investment for me. So what would be a good case story? You think, well, this is an example of, obviously we don't need someone's name, address, etc. But how you saw that on an individual.
So that's really interesting. So preparing for today, read a number of stories of a whole range of different people who've been involved within digital lifelines, and there are some real common threads within those stories. I think the first one is that it's not just an individual that benefits, it's their family, it's their friends, it's the support services, and ultimately, as well as that individual, it's Scotland's economy. So those are writ large across all of the stories. I'm going to read an amalgamation of things that people have said within those stories. And it's the smartphone and support offered me a lifeline. It provided immediate access to essential resources, support services, support workers, access to benefits to maintain contact with friends and family, to find support which was tailored to my needs and support that I needed at the time that I needed it. It helped me to do really basic things around navigating to appointments, making sure that I'd got alarms set to take my medications on time, to really make sure I was engaged. And of those stories that I was reading, I read, sort of 5 or 6 of them. One person went on from being released from prison to undertaking some volunteering, and that was helped and established through the support and through their access to the device and the skills that they were learning. Somebody was maintaining some family relationships through really difficult times. This person's father had just died. And so that device was for the entirety of that family and how they supported themselves and were supported to go through that bereavement and grief process. Somebody else has completed a course in data science, and another person has completed their engineering degree. So those are just 4 stories amalgamated together from about 6. And those are really powerful. This isn't that people are scraping by through life. It's actually a hope and a lifeline to massive achievements personally for themselves, for their families, and for Scotland.
It offers a future. I think that's the what you're saying there, that lifeline to the future. And that future, I mean, you, Moira, in terms of what would your hopes be for what's next, basically, for you? Do you think with digital innovation in Scotland, what could look like in the future? Do you think?
So DHI's role in supporting the Digital Lifelines programme has been really useful and interesting for us. And we're able to use our networks that we already had established to think about where we might go next with it. Because initially it was set up as a 4-year programme, and we're into, 2.5 plus years of that now. So what we're starting to think about, and the portfolio group that manages the programme are thinking about, is exactly that question, where next? And thinking about how we might call out internationally and say who else is doing things in this area that might be useful for us. Are there collaboration opportunities that we want to pursue round about that? And seeing research as an important element of the work that we've been doing as well. So a lot of the insights that we have gathered as we progress through the programme has been very much because we have embedded that research and evaluation methodology throughout. So we've been working with the University of St Andrews, the University of Stirling, and the Drugs Network in Scotland to think, what are we learning as we go along, and then how do we agilely adapt as we go forward? So we see where we've got to in Digital Lifelines as a foundation, for what we might do next. And in conversations with colleagues, Alex and I are both in conversations with colleagues in Northern Ireland and the Republic of Ireland, looking at the Peace Plus programme opportunity that's coming through, and a particular call round about addictions, and how we might take some of the learnings from Scotland and support Ireland to move ahead as well, but then obviously helping us accelerate some of the efforts that we're already making round about the products and the inclusion agenda that we've already set off on. So I think it's only going to start to gather momentum increasingly as we go forward, and that was absolutely needed.
And cash always helps in these things.
Cash definitely helps, yes. I think without that, it's very difficult to do the research and innovation.
It is. I'll come on to that back in a second. I'll ask you about that. But for you, Alison, what are you, from what you've heard, what's there in the future? Do you think?
Yeah, I think the future is quite. I don't. Is quite uncertain in terms of addiction, in terms of substance use. We are absolutely committed to continuing with the maintaining the growth of the quality of our treatment services, our harm reduction services. I think, all of this is very, very important to continue to maintain. But I think our sort of underpinning commitment, and I was interested in what you were saying, is that we put people with lived and living experience at the centre of our policy making. And that actually, when we have made those, that we've done, long and significant consultations now through our national collaborative, and which is a participative and human rights based kind of approach. And often it's, what people are asking for is really, help with their lives, not necessarily specifically their drug use, but with all of their lives. And I think what I'm hearing from the digital is that this is really, really important, and we cannot ignore the importance of digital, connection for people increasingly as time goes on, and also the nature of substance use is shifting. I think we're all read in the press about the new synthetic drugs that are coming down the line. The different demographic of people who you're using. So, there are lots of things for which we have no immediate answer. And I think that the more, therefore, we have to really concentrate on how do we help the whole person and not just the substance, because actually we haven't got an answer for substance in many circumstances. What we need to do is help individuals who may be at risk or vulnerable to going into substance use, to find ways of managing their lives in a way which is better supported and which may prevent them hitting those crises in the first place, because ideally we would rather not they got into crisis in the first place, which is where I think we need to focus our attention, and where I think digital is really important.
And it's where I've seen it work in the US.
Absolutely.
Because they've used that with the fentanyl issue that they've had to do.
Yes.
They've sought the answer through digital very often.
And real-time immediate information for people who are at risk, I think, is very, very important. And again, I think digital is one of the areas that could very much help us.
So we've talked about need. We've talked about some ideas in terms of the background for what you do. We've talked about some of the impacts that we've seen. And we've briefly touched on cash. I usually talk about need, solutions, cash. But then the last thing for me is the so what. What we're going to do next. Where's the opportunities to collaborate? So certainly for you, Alex, where's the opportunities to collaborate with you?
I think in a way, sort of, the discussion is going on very, very well, to make my response easier. Again, I said, digital is an opportunity post-COVID to do things differently and quickly and effectively. And as you know, the Health and Social Care Directorate, the delivery of services has a lot to learn around, responsiveness and timeless. But I think what's important as well is to recognize it is not just about the users, it is about the providers, and it's about the system. Because if the system doesn't move or shift or understand what digital is all about, you could have the best providers, have the most willing users and supported users, and there's a problem. So those were the conversations we had when we set up the Reducing Drug Deaths Consortium as part of the CSO innovation. And we've put in a challenge call. So what?
Right, okay.
We've put in a challenge call. We managed to attract £5 million of money, cash.
They're interested. I can see their attention entirely focused now.
And through the Scottish and UK government. Okay. So it became a UK based initiative where we asked small, medium enterprises to work with social and healthcare providers, to work with universities in order to provide, it was very clear and very simple, timely and effective way of recognizing and responding to imminent, potentially fatal overdose. Okay. So the call went out in January, and currently we're working with 11 prototypes.
Cool. Okay.
And those prototypes, of course, have been funded through 5 million, and the prototypes had 4 months within which they will be able to show that they're able to move to phase 2, which is the demonstration sites, and to essentially say, show us that what they have written on the application form is actually they're able to do that. And some examples are way, beyond what I even imagined. So, for example, we're talking here of one of the antidotes that we encourage patients, families to have is naloxone. Some are working in order to have not only a very quick way of delivering or taking naloxone, but also having a product that has naloxone and flumezanil, which is an antidote for benzodiazepam. And we know that most of the drug deaths is because of a cocktail of sedatives, usually opioids and benzodiazepam. So you could see that's a game changer. And then we have others who are using a wearable type of technologies. And I mean, not just the ones that surround the wrist, I cannot mention the products, but also technology that is used within fabric. So people wearing socks, shirts, etc., which would measure your oxygen saturation, measure your movement, your breathing, etc., which we know are usually. And then we have another one, which is using drones. How do you not only able through GPS systems identify what is, certain people through these wearable technologies might be tipping into an overdose event. And we have about half an hour, 1 hour of that moment in time where you could save a life, where but might be in the islands at Highlands somewhere, and the ambulance will take 2 hours. So how can we use technology like drones? How can we use other types of immediate ways of connecting people together into the system? So in December they reached a 4 month period, phase 1, and I'm glad to say that most of them are really, really keen. Not only have they passed the test, the litmus test, moving on, but they're applying for the phase 2, which is 18 months long.
Is that this year? Is that this year?
So the process would phase 2 will start around March.
Right, I see.
2024. There's money already funded for that, for potentially if all the 11 prototypes move to demonstration. So there's no issues about the money, etc. And I hope, in due time, if you ask me the right question, I will tell you what the plans are for 2024 and 2025.
Now's your chance. Tell us about 2024 and 2025.
Okay, thank you very much. I'm struck by what everyone had said here, and it resonates very much, with a lot of people who work in the field of substance misuse I mean, substance, not just illicit drug use, but also alcohol use as well. Need to, the issues of comorbidity, the issues of information, data. So there are two planned, hopefully, we will attract enough money, challenge calls. One of them is around surveillance and data intelligence.
Right.
And I mean, not from a criminal police perspective, monitoring, but is how can all the stakeholders, how can all the players know what is out there? How can they access the right service at the right time? How can we understand who is most at risk? How can we utilize AI and metadata and data linkage, which is, top for Scotland to be able to do that through the CAI and others. And without, of course, infringing on persons' human rights, information, private data. So that's one challenge call. The other call is about systems, as I mentioned. How do you make a system that is person-centered, that is responsive to the needs of the individuals? And that takes some new way of thinking. Moira knows me too well. I always mention the word implementation science. Is how do you use issues like syndemics and other processes in order to understand that if a new drug comes into the horizon, we know about what is happening, what the potential is, but no system is changing. It's how do you move that big tanker, in order to be responsive. And digital platforms are one of those where we can very clearly, as Moira said, very clearly be able to shift, assess, identify, diagnose, try, use the right evidence-based biopsychosocial intervention. So watch the space.
Watch this space. So this year, so we will, ECHAlliance will undertake to broadcast that through our network. That's what we do.
Yeah.
Okay. So we'll broadcast that. Sally, I can come to you. What have you got that's interesting in the coming year that people need to keep an eye out for?
Well, just published. It's a digital inclusion roadmap,
Right.
for Scotland, which focuses on what everybody can do as part of one of the 5 areas of digital inclusion. And that's whether you're an individual or whether you're part of any organisation. So what can you do to support people with their skills and confidence? What can you do, industry, around affordable connectivity, around making sure that people have the right device or suite of devices for them? What can you do to motivate somebody? Well, that could be somebody within your family, it could be a colleague, it could be, sort of anyone that you know. And for organisations and services, when you're designing and redesigning, then what are you doing in terms of that co-production, whether that's with an individual, with a new, with service, with staff and volunteers? How are you designing that service so that it brings people along a digital inclusion journey, and it's a really pleasant journey to go through and not one that has barriers? I think we're really lucky in Scotland. So SCVO have been working on this agenda with colleagues in Scottish Government and others for about 15 years. And that's a really privileged position to be in, because what we have created within that is a movement and a lot of understanding. And I think that creates one of the real planks of why digital inclusion is thought about by such a diverse range of organisations. So we've harnessed that within the roadmap, and you will be seeing it. It's on the SCVO website. Everybody's got a copy. Everybody's got a copy of it. So I and colleagues will be coming across over the next year and talking to people about, so what can you do? It could be a small thing, and nothing is too small. It could be a larger thing. And then sharing those stories, again, back to stories, sharing those stories with other colleagues to inspire us, because this is a job for everybody in Scotland. It's no single organisation or person's job to make sure that people are digitally included, and thereby supporting people out of social exclusion and chipping away at poverty, which is something that we're all here and engaged with. So that's coming from us.
Okay, well, again, your members, if I'm not mistaken, of ECHAlliance will publish whatever you chuck at us, because that's important to get out for, not just in terms of people's understanding of what you're doing, but also for other organisations in other countries who are in similar positions. Because I think actually we can take that. Scotland's fantastic at this, because of the size of Scotland, of creating reusable strategies and plans for other countries. And it's something I think outside, because I see outside of Scotland all the time, they always look to Scotland and think, well, what have they done? So that's useful. So we're broadcast and amplified, whatever you chuck at us, through our social media and our communities. I'm conscious, obviously you can do that through DHI as well, because they've got a fantastic newsletter that you can subscribe to. We'll put links in the recording.
We have a plan, don't worry.
Yeah. And I think, Moira, come back to you. What have you got planned in for 2024?
Well, for me, it's about thinking, one of our colleagues the other day there said there's a need now to join up the dots. So it's very much about lots of great stuff happening in different areas. How do we actually join that together so that, it starts to gather that momentum that I referred to earlier on? And I think one of the key ways of doing that is almost seeing the partnerships that we already have as an opportunity, a bit like an innovation cluster. So we had our conference back in September, and we were deliberately inviting people from different countries and from different experiences to come together with our happy band, just to say, how do we expand that learning? How do we create an environment in which we continue to invest in research and innovation in this space, and actually just move it on? So that, for me, we've got a community of learning that's already in place, that's supported by SCVO. I'm quite keen, and there are discussions to be had about how do we expand that community of learning, how do we use our conference in a much more open and expansive way, and again hoping that you guys in ECHAlliance are very much going to support that wider collaboration and international partnerships that we can pursue through that as well.
But there's funding, obviously. We've heard about, obviously we've seen opportunities for funding calls coming out this year. We've got roadmaps being published, we've got and being broadcast, and we've got conferences coming up. Your next one is going to be, when's the next Lifelines conference?
June. So the plan is we have one in June 24. We're still debating whether it's the 4th or the 11th. It's looking like
Details.
the 4th of June. So keen to, again, you circulating that around your network so that we can attract others to come along.
And the other thing I think we've got within our network, we've got an implementation of ecosystems. So these are 80 global ecosystems, as well as 13 thematic ecosystems. The thematic ecosystems are, I think, where the answer lies. So we've got one on mental health. We've looked at isolation, self-harm, substance misuse in the past. I think there's a way to come back to that and say, well, what are we doing about digital around substance use and death prevention? And I think we're more than happy to co-host that with partners here from Scotland and showcase Scotland to the rest of our community, because it's an issue in other countries, in Germany, in Africa, in the US, in Australia, that they want to know what the answers that other countries are doing, especially Scotland. So let's use that as a way to connect up those dots. We can do that, and hopefully start connecting dots between what we're doing in Scotland outside. So thank you, Alex, Moira, Alison and Sally, for your contributions today. Hope you've enjoyed the chat.
Yeah,
I've certainly learned lots, and I feel more positive than I did when we started.
Oh,
Good.
Thank you.